Hello everyone, my name is Crystal Anderson. I'm a nurse at Glenrose Nursing and Rehab. You've probably had somebody you know in the hospital and they've had an IV, also known as an intravenous line. Today I'm going to go over the steps of how to insert one and kind of touch on the reasons why they have one, the purpose of it. First, what you'll need is to gather your supplies. You'll need an IV start kit. It'll come with a roll of tape, a tourniquet, an alcohol prep, and a 2x2 tegaderm to cover where you actually insert the catheter. And then you'll need what's called a head lock. It's used to go at the end of the catheter that stays in the vein to keep the blood from flowing back out, and also to keep the line open so the patient doesn't have to be restuck multiple times. And then you need a 10 cc normal saline filled syringe to flush the line. The purposes behind having an IV is for diagnostic measures, for fluid to rehydrate your body, and for in trauma they can give blood. They can also give antibiotics with it. First thing you'll want to do is introduce yourself to the patient, kind of explain to them what you're going to do and how you're going to do it. Put your gloves on. Decide if the patient's left-handed or right-handed, or if you can use their left or right arm. Whatever is best for them and helps get your job done. Then you'll want to apply a tourniquet far enough above the vein where you're going to insert. You're going to want it to be tight enough to make the vein pop up, but not tight enough to cause the patient too much discomfort. Once you have that on, you should find a good vein. You'll want to clean the area with an alcohol swab about 2 inches in diameter. Make sure that alcohol pad's visibly clean, their skin's not dirty. You don't want any infection. And then you want to choose the size of catheter you're going to use based on the size of their vein. Also, a thing to help the patient be more comfortable, just kind of show them that it is just plastic that you're going to leave in the vein. There's actually no needle left in the body. You'll want to pull down tightly on the skin. Insert the needle bevel up. Once you see flashback back in the angiocath, go ahead and insert it into the vein. And then pull the needle out. Make sure that your hep lock is flushed and that there's no air in the hep lock. Inserting air into a patient's body can cause fatal injuries. Once you have that hooked up, pull back and make sure that you have a good blood return, and then flush it. The flush should not cause the patient any pain or discomfort. Once you have a good flush, you can go ahead and pull off a piece of tape so that you can properly secure the hub of the cath that's just left in there to the skin. And then you'll want to make sure that you lock the hep lock back so that none of the blood flow is flowing back into the tube. That'll startle the patient. And then you can cover the site with a 2x2 tegaderm. Make sure that you're covering the hep lock and the insertion site and can prevent infection. And then you'll want to date it and initial it. So I've showed you the basic steps and procedures on how to start an intravenous line or an IV line. I've kind of gone over the different purposes of having it for diagnostic measures, for fluid, for blood, for long-term antibiotic therapy, and then also just a few tips that you can do to ease your patients. Just help them remember that there's no needle left in their hand, that it's just plastic. Hopefully this will help next time you have a family member who gets an IV or you have to start one.